All right. Welcome and thank you for joining. My name is Ashley Lusick, and I am a health educator for community health at Atlantic Health System. Today's webinar, Stroke and Hypertension, is presented by Heather Gasser and Lori Coons. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A button and use the chat feature for comments. We will try to get through all questions at the end of the presentation. Are you or a loved one interested in smoking cessation? Atlantic Health System offers a free quit smoking program. This program includes an individual assessment, free nicotine replacement products, and 6 weekly group meetings to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about these groups and other resources or for additional dates, please call 1-844-472-8499. Finally, before Heather and Lori begin, we'd like everyone to take a quick poll. Please take a moment to answer the questions you see on your screen. Your answers will be anonymous. All right. Thank you so much, everyone. I am now going to pass things over to Heather and Lori.
All right. Good evening. My name is Heather Gasser. I am the Stroke Program Manager for Newton Medical Center, and I am looking forward to sharing everything about stroke and hypertension with you guys. So I'm going to share my screen. All right. Can everybody see my screen? Lori, can you see it? Okay. All right. So first, before we can really understand how hypertension or high blood pressure affects stroke, we really need to know what is a stroke. So stroke occurs when the blood flowing to the brain is interrupted and the brain is no longer receiving that blood and oxygen, and the brain cells die. When somebody's having a stroke, 1.9 million brain cells die every minute, and therefore it is a medical emergency. It is the 5th leading cause of death in the United States, and it is a leading cause of long-term permanent disability. So that means if when you have a stroke, we want to get rapid treatment because it can leave you with that permanent arm weakness or permanent speech problem. 80% of strokes are preventable, and this is through managing what are called modifiable risk factors, such as high blood pressure. There are 2 types of stroke, ischemic or hemorrhagic. The first type, ischemic stroke, is caused by a clot blocking that blood vessel that leads to the brain. It is either caused by fatty deposits, so when their cholesterol builds up and it lines the blood vessel wall, or when the blood vessels become too narrow. 87% of all strokes are ischemic stroke. And again, this is related to those modifiable risk factors. The two types, it's called a thrombus. So when the clot occurs directly in the blood vessel. So this is if the plaque builds up, so that fatty deposits build up and the blood clot catches and it blocks off the artery, or an embolism. So the blood clot starts in a different part of the body and then it breaks off and travels to the brain, blocking the blood vessel in the brain. This most commonly occurs when somebody has atrial fibrillation. The other type of stroke is hemorrhagic stroke. This occurs when there is bleeding into or around the brain. It accounts for about 13% of all strokes, and it is more fatal than the ischemic strokes. The ballooning occurs, so as you can see on the screen, that aneurysm, when the blood vessel is weakened, and because high blood pressure does weaken the blood vessels, it can cause this. So similar, if you think about a tire, when you overinflate a tire, those tire walls become weakened and then that tire blows out. So it's the same concept. As the blood pressure is weakening the walls and it's high force, it will end up tearing or rupturing into the brain. So the two types of hemorrhagic stroke are subarachnoid hemorrhage. So this occurs on the surface and bleeds between the brain and the skull. So again, that's caused by that little sac, that weakened area of the blood vessel that bursts or ruptures open. Or intracerebral hemorrhage. So this is when the blood vessel bleeds into the deep tissues of the brain. We also have what's called a transient ischemic attack. This is often known as a mini stroke. This is similar to the ischemic stroke, where it is caused by a blockage of the blood flow, but then blood flow is restored. So it's temporary blockage. It is a warning sign for a real stroke. You will experience symptoms similar to a real stroke. It usually resolves within the minutes to hours. There is no permanent damage, but more than 1/3 of patients experiencing a transient ischemic attack will go on to have a stroke, and it's usually within the first 48 hours after the attack. So we do consider it a medical emergency. So risk factors for stroke. Things that we cannot control. So age, if you're over the age of 55 or older, your stroke risk doubles. Gender, females are more likely to have a stroke and they're also more likely to die from stroke. Race and ethnicity, so Hispanics and African Americans. And African Americans are also more likely to have high blood pressure problems. Any kind of family history of stroke, transient ischemic attack, or heart attack, and then previous stroke. Risk factors for stroke that we could treat or modify. So these are things that we can control. The number one risk factor, hypertension or high blood pressure, atrial fibrillation, smoking, diabetes, obesity and physical inactivity, high cholesterol, coronary artery disease and other heart diseases, our diets, and peripheral artery disease. So ways that we could manage this are through eating healthy. So we know that sodium leads to high blood pressure. So eating diets low in sodium. Getting more physically active. So walking, more exercise during the week. Controlling the amount of carbohydrates, sugar that we eat, and also fat foods that are high in fat. So hypertension or high blood pressure, it is the number one risk factor for stroke. Nearly half of all American adults have high blood pressure. It is called the silent killer because there are no symptoms to signal when one has high blood pressure. A normal blood pressure is considered 120 over 80. The top number is the systolic blood pressure, and that's the 120, and then the bottom number is the diastolic. So what is high blood pressure? This occurs when the force of blood flowing through your arteries and other blood vessels is consistently too high. When this occurs, it does do damage to your other organs, including your kidneys, your brain, and your blood vessels. When the blood vessels become weakened, it does allow for pockets of that fatty deposits to build up, and that's how the stroke occurs. And then some effects of hypertension. So because high blood pressure increases the workload on the heart and blood vessels, overall, everything is working less efficient. The force and friction causes damage to the delicate lining of the blood vessels, and this leads to that narrowing or weakening of the arteries and will lead to that heart attack or stroke. And then I am going to flip it over to Lori. All right, Lori, can you take control?
Yes, I'm on it. Here we go. All right. And how's that look? Are we on?
We are on.
All right. Well, hi, guys. So glad to be here. Thank you, Heather. That was an awesome half of the presentation to get us started. So we're going to go a little bit more in depth on the silent killer that Heather introduced us to. So it is the silent killer because it does sneak up on us. It doesn't really have any symptoms. And if you're not looking for it, you're not going to find it. So that's why we really want you to, be aware and to go ahead and be in touch with your body and your blood pressure. It's really important that you monitor it because nobody else is going to notice it from looking at you that you might have high blood pressure. So the top number, as she mentioned, it's systolic blood pressure, and that's how much pressure is actually being exerted while the blood is being pumped through the vessel. So as the blood is being pumped, that's the pressure exerted on the vessel wall. Now, the bottom number is when the heart is not pumping, it's the pressure that's being exerted on that vessel wall in the relaxation phase. So that is really concerning because if you have a lot of pressure on that vessel when the heart is not actually pumping, that's a bigger concern. So these two numbers tell us a lot, and it's important to know what they are. And it's important to know what your numbers are and not just one reading. One reading isn't going to get us really concerned or excited. So please don't run to the emergency room if you have high blood pressure once, but we'll talk a little more about that. So we want you to monitor your blood pressure. We want you to see your physician. If you don't have any medical problems, hopefully you're seeing a physician at least once a year for a physical, a checkup, just to touch base. But if you have any concerns, any risk factors, or any reason to check it more often, and we certainly advise as we get older that we do that, we want you to know how to properly check your blood pressure at home. So be still, relax, non-exertion for about 30 minutes before you're going to measure your blood pressure. We also want you to make sure you don't have a full bladder because we all know that'll raise it. We also want you to make sure that you relax for about 5 minutes and sit. When you take your blood pressure, be in a comfortable position, okay? Uncross your legs and just sit and relax. Sit with your back straight, your feet flat on the floor. Your arm should be supported so that the upper arm is about at the heart level. We want it nice and even there. The bottom of the cuff should be directly above the bend in the elbow. You want to measure it at the same time every day. Every day, our blood pressure will fluctuate throughout the day, and that's normal. We have different stressors during the day. We have different times of the day that our hearts need to work a little harder. Our bodies have higher demands. So that's normal, but try to take it at the same time every day to gauge how your blood pressure actually is. Take multiple readings and record the results. Write them down. Don't try to remember them. Write them down. Take 2 or 3 readings, 1 minute apart, record the results. Store those readings on a little notebook or a pad of paper, and then take them to your doctor's appointment. Have that discussion. If your blood pressure is really okay for a while, then have that discussion. Let your doctor know that you've been running normal, because then if you have an occurrence where you're getting higher readings for an unknown cause, then that's going to give at least a baseline to refer back to, and the physician can then take that as, you know, documented information and good information and look for the cause why your pressure is elevated. Try not to take the measurements over clothes. You really want to be able to take it against bare skin. So try to be in a t-shirt or get your sleeve pulled up so that that doesn't hinder the reading or alter the reading in any way. And we do have normal variance between the left and the right arm. So that should not be a big concern either. That 10 points difference is absolutely normal. Now, if you take it consistently in both arms and you consistently have a difference between the two arms that's 20 or 30 points, might be a good reason to contact your physician and have them take a look at you. Okay, so that would not be normal. Excuse me. So when we talk about the high blood pressure readings, a single high reading, of course, is not an immediate cause for concern. But if you get a reading that's slightly or moderately higher than normal, take your pressure a few more times, consult your doctor. Again, document it and see what was different when I took it. Did I take it in the morning one day and after dinner another? And again, that pattern might be a little easier if you document it and you can pick up on the differences. If your blood pressure readings suddenly exceed 180 over 120, we're going to wait 5 minutes and we're going to test it again. If they're unusually high, contact your doctor. You might be experiencing a hypertensive crisis. So that, of course, is a concern for us. We don't want you to be having a hypertensive crisis. If your pressure is higher than 180 over 120 and you're experiencing possible signs of organ damage, that would be something that affects your heart. Maybe you're getting chest pain, you're feeling a heaviness in your chest, maybe some shortness of breath. Maybe you've got pain that goes into your back or your neck, some numbness or weakness. Those are all concerns. You might have changes in your vision, trouble speaking, headaches. All right, if those things are occurring and you know that your pressure is high and that's not normal for you, and it's an onset that's kind of sudden, those are all concerning things that we want you to pay attention to. Those are the reasons that we would expect to see you in the emergency room or make urgent contact with your physician, okay? So that is a good reason to call 911 and be seen in the emergency setting. We want you to manage your high blood pressure. If you've been diagnosed with high blood pressure, we want you to work with your doctor closely. Report any side effects from your medications. We want the medication to be taken as it's prescribed. Don't stop without your doctor's approval. When Heather talked about the damage to the vessels, you've got the inflammation and you've got the damage occurring to those vessels. A lot of the medications that we'll mention in a few moments are going to relax those vessels. They're going to relax those vessels and allow more blood flow to go through. And what's going to happen is if you stop those medications, there's going to be a rebound effect. Those vessels are going to get angry. And we don't want angry vessels. We don't want an angry heart. We don't want angry vessels that are pumping the blood to our brain much harsher in what they're supposed to do normally. So you don't want to stop those medications. We're going to manage our blood pressure with other ways too. Heather mentioned a healthier diet, something that's low in salt, a heart healthy diet. Low in those saturated fats and cholesterol. We want you to increase your fruits and vegetables, right? If you're a meat and potatoes lover, that's great, but try to introduce a couple more days a week with the fish and the chicken and the pork, something that's a little lighter for the body, something that's a little less in those saturated fats and cholesterols. The regular physical activity. Now, the recommendation is 150 minutes a week. That's not a Saturday morning workout for 3 hours. Don't do that, okay? Spread it out over the week. Do some walking. Take stairs instead of the elevator when you can. Get that, 30 minutes over 5 days. You want to break that up. 30 minutes each day for 5 out of 7 days. That's not too hard to do. increase your activity level. It will go a long way. And remember, exercise gets all of our bodily systems working better together. So your GI system's going to work better. You're going to feel better. Your muscles will ache less. That's what we want to do. We want to get all of our bodily systems working better. And certainly our blood pressure will be better managed if we have an increase in our activity level. Obesity, as we know, is going to be a risk factor. And let's face it, in the United States right now, we're all fighting obesity. So we want to maintain a healthy weight. We do that through diet and exercise at first. If that's not enough, we might need medications to help us as well. So don't be afraid to address your obesity. You know, we're all a little bit bigger than we'd like to be. We're a little bigger than we should be for a healthy weight and healthy lifestyle. So take obesity, address it with diet, exercise, and try that weight loss. For hypertension and for the risk of stroke and heart disease, it is really a big cause. Maintaining that high blood pressure, we also need to avoid that tobacco use. Smoking is a really strong risk factor for stroke. And certainly if you have smoking and high blood pressure, your risk for stroke is heavily increased. So we can avoid tobacco use. If you are a smoker, even cutting down will help to make a difference. So cut down on your tobacco, and hopefully you can take advantage of Ashley's smoking cessation program that she mentioned and introduced earlier. And we'd love to see you take advantage of that. Also, alcohol consumption. Now, we know cardiovascular recommendations might include a glass of red wine at night with dinner. Well, one glass of red wine is very different from alcohol every day that goes from beer to hard liquor and a little binge drinking on a weekend. You know, we want to avoid those things. So really everything in moderation is better, and limiting your alcohol consumption is really a key component for that as well. So we're going to manage our high blood pressure. We're going to fight stress. Well, how do we fight stress? I'm a big one on laughter. So laughter is just so good for the soul, and it's good for the blood pressure. So I'm all about that. But when we say let worry go, reduce your stress levels, you know, just don't stress about it. Nobody's going to listen to us. We know that. What we do encourage is that you have a healthy outlet for the stress. Mine is often laughter. However, there are other things that can help you reduce your stress levels. You can organize your environment, whether it's your living environment, your work environment. Clutter and disorganization is an indirect stressor. We might not realize it's stressing us, but by golly, it is. So you want to take care of what you can. Reduce the stress in your environment that you spend a lot of time in, make it a more comfortable environment, more organized. That will help. Practice giving back. It's amazing what you can do. I've been volunteering for a long time, almost 40 years. And I can tell you, volunteering in any capacity just makes your heart happy. When your heart is happy, your blood pressure, your blood vessels are happy, your brain is happy, your blood pressure is happier. So volunteering is a great way to give back, and you reap the benefits through volunteering. Give up the bad habits. Again, the smoking, the drinking, the staying out late, not getting enough sleep, all those naughty things. You want to reduce those bad habits, and that will help to reduce stress as well. And sleep is really important. You need to slow down. You need to have a good amount of sleep that's required for your particular age group. It might be 6 hours, it might be 9 hours, but it's going to be what your body needs to have you feeling well. Lean into those things you can change. Make time for something new, a new skill, a new hobby, things that make you happy, things that make you feel better about yourself, about your environment, about, you know, your day-to-day life. Things that are making you feel better will help you to reduce stress. So it's time to take care of yourselves. We have some medications that will help to minimize the risks associated with high blood pressure by controlling them. So medications will go a long way. But again, you can't stop medications once you get on them without your doctor being directly involved with that process. If you do it unsafely or suddenly, again, that risk is elevated for that rebound effect and for some very detrimental side effects. So partner with your doctor. Discuss all the medications that you take. If you take something for blood pressure, there might be side effects where you can't take something for, a chest cold or a head cold. Now we see all these ads on TV for the blood pressure friendly decongestants, right? So those are things that we've had problems with over the years. If somebody had blood pressure medication, they couldn't take a lot of those medicines. And now there are new avenues to treat things simultaneously with your blood pressure medications. But you should talk to your pharmacist and you should talk to your physician about taking those hand in hand. Okay, if you're taking it over the counter with prescribed medications, run it by your physician or your pharmacist. We want to follow those recommendations carefully, even if it means we're going to be on this medication for the rest of our life. Heather and I see stroke patients all the time, and a lot of them are going to be on blood pressure medication or statin medication because controlling that cholesterol and that blood pressure is extremely important. And you know what? The side effects that come along with some of those are often so minimal compared to the benefits that you get from taking those medicines. We really do encourage them. We want to be aware of how certain over-the-counter medicines interact, like the decongestants that I mentioned. So please, please, please contact your provider and or your pharmacist if you have any questions on a medication that you're introducing to your system, in addition to your prescribed medications. The different medications that we see often for high blood pressure, as you can see, there's a whole bunch of them here. So we're going to just talk about some of them quickly. And we're going to touch on some of those that have side effects and what to be aware of if you're taking them. So a diuretic, for instance, like a Lasix, a furosemide, a hydrochlorothiazide, those are diuretics that make you pee more because with blood pressure, sometimes we control, we maintain higher levels of fluid in our system and we need to get it out of there. It's got too much fluid and the heart has to work that much harder to pump that extra fluid. So we might want to get rid of some of that. What happens though is that we release a little more sodium and we lose that sodium. So it can cause our fluid and sodium to go down and we end up with low potassium, which is no good for the heart. So when you take a potassium sparing diuretic like a Lasix or a thiazide, sometimes we have to take a little extra potassium through our diet, our green leafy vegetables, our bananas, things like that, or sometimes a supplement so that we don't get too low of our potassium and have a complication to our hearts. There are beta blockers. A beta blocker, you might know, affects the hormone of epinephrine or adrenaline as we also know it. And the beta blocker helps to block that effect that would elevate our heart rate and our blood pressure, and it opens up and widens those vessels to increase our blood flow. So some of the beta blockers that are common, metoprolol, atenolol, propanolol, and beta blockers can also reduce our heart rate a little bit, help to control that so that we don't get hyper elevated with blood pressure due to our elevated heart rates. Then we have ACE inhibitors. ACE inhibitors and the angiotensin II receptor blockers, they both work to affect the hormones that elevate our blood pressure, narrowing those arteries and the blood vessels. And what they do is they kind of relax them a little bit so they can reduce the work on those vessels and the inflammation that goes on with that stress on those vessels. So they work hand in hand or similarly as one another to reduce the workload on those vessels and widen them so blood flow can be increased. Then we look at calcium channel blockers. Some of those might be amlodipine, Procardia, Cardizem. So what they do is they block the calcium from entering into the cells. Calcium can cause the heart and the arteries to squeeze or contract harder. And we don't want that. So we want to reduce the calcium that's getting in there. We want to lessen the load. and slow that heart rate a little bit. It'll also help to dilate or open up, widen those blood vessels. So all of these things work to improve the blood flow, lessening the stress on the vessel walls, and allow the blood pressure to be productive, but at a lower rate, so it's not so stressful to everything. Then we have, alpha-2 receptors, alpha and beta blocker combined medications, central agonists, peripheral adrenergic. Okay, I can't say that today, so we're just going to move on. But all of these different medications work a little bit differently, but they all try to accomplish the same goal. Okay, and the last one is vasodilators. Vasodilators will open and widen those blood vessels a lot. Okay, these are the medications that we use when the other ones have failed us or they haven't been enough. So an actual vasodilator that works strictly on opening up those vessels is not going to be the first line medication. So that's one when we've really struggled to find effective medications in those we've listed up above there. All right, so the vasodilators, they have numerous side effects, so we don't want to use them as a first line. But sometimes if somebody has serious blood pressure that needs to be controlled and it's difficult with the ones that we touched on, then we'll have to resort to the vasodilators. So there are a lot of resources out there. You can Google your heart's content for blood pressure management, blood pressure and heart disease, blood pressure and stroke. The American Heart Association and the American Stroke Association have numerous resources. If you go to their websites, and you can, take it off of the screen here, or you can Google it, stroke.org, heart.org, their resources are evidence-based, proven, real information. Okay, so the science, the research that's done that makes us be better at providing the care for stroke patients is because of the studies that these folks have done internationally and the data that they've gathered through studies and through research. And they don't implement changes unless they're validated. So everything that we do and we strive for is to provide the highest level of care for those stroke patients at our facilities. Heather's the stroke manager at Newton, and I'm the stroke manager here at Hackettstown. And we are very proud of the awards that we've received from the American Heart and American Stroke Associations, because we voluntarily commit to a grading system for the care that we give to these stroke patients. And we follow the evidence and the research and the best practice guidelines for all of the care that we deliver. We're really proud of that. With that, we have stroke support groups. We offer stroke support groups for not only stroke survivors, but also for stroke caregivers. So when somebody in the household suffers a stroke, then obviously it affects everybody in the house or the home or the family, because now lifestyle, as Heather mentioned when she talked about, the leading cause of disability, well, a lot of people survive strokes, but a lot of them do not get back to 100% of what they were before the stroke. So it's about living in a different body. It's about living with a different mind. It's about living with different limitations. And it's important that we support each other. We support our stroke survivors because, let's face it, they've been through an awful lot. And then we need to support our caregivers because they're facing challenges they never thought they would. So we offer these every month. It's on the third Thursdays. The caregiver is at 1 o'clock and the survivors is at 2 o'clock. And we have a facilitator for that. It's all virtual right now, and it's probably going to stay that way for a while. But it's virtual, so you can check in from anywhere. You don't have to worry about transportation and valeting the vehicle and so forth. And then the stroke program managers, we all take turns. We're at Chilton, Hackettstown, Newton, Morristown, and Overlook, and we usually try to have at least one of us on there, if not two. We're answering questions for you, and it's really a great forum to support one another and share resources and, best practices that you guys have found as a stroke survivor or a caregiver. So that's always available, and we give that to our patients as they come through the hospital in our stroke education packets. So they go home with that information. Now, we are going to finish up reinforcing a great way to identify if somebody is having a stroke, because we talked about the hypertension. We talked about, the do's and don'ts and the good things we can change, the things we can't change, but we can make things better for ourselves. Let's talk about how to recognize a stroke, because early recognition is key. All right. Some of you may remember we used to say fast. Fast is how we recognize face, arm, speech, time. Well, the last few years, we've really realized we weren't capturing as many strokes as we could. So we've implemented be fast, because we're going to look for balance issues, balance difficulty. All right. If you normally walk around with a cane and you woke up this morning and your cane isn't enough, you're looking for a walker, or you're falling a lot, you've fallen 3 times this morning, maybe it's a balance issue. That could be neurological. So we want you to pay attention to those balance issues. And if that's a sudden onset and your balance is off, let's take a look at it. Call 911, come on in and see us. How about eyesight changes? Sudden eyesight changes, such as loss of vision in one eye, part of your vision loss, double vision, blurry vision. You're seeing, things you shouldn't be seeing. Maybe you're only seeing them on one side. Those are things we want to know about. You can call your eye doctor, but the eye doctor probably can't see you for a couple of days. So we don't want you to wait to see the eye doctor. If it's a sudden onset, we want you to come to the emergency room. If it's a gradual, you've been working on the computer 10 hours a day for the last 3 months, all right, I can see you might get a little blurry, you might get some headaches. That we kind of have an excuse for. But if you don't have that level of, consideration that you can explain it in good, strong detail to wait for your eye doctor, come in and see us in the emergency room. Now, that's the B and the E, and then we get back to the fast that we've been practicing for many years. The facial droop. If there's a droop to one side of the face, we want to be concerned about that. If there's arm weakness, if you ask somebody to hold their arms up and all of a sudden they close their eyes and one arm starts drifting, that's a problem, right? If they can keep them up with their eyes open, but they close their eyes and it starts drifting, that is not okay. That is arm weakness on one side. So we want to know, we want to see them in the emergency room very quickly for that. Speech difficulty. Are they slurring their speech? Like they're drunk and they're not? That's not normal. We don't want to ignore that. If they're having trouble finding their words or getting their words out, or they're not making any sense when they get their words out, that's concerning. That's not normal. So we want to see them. The time to call 911 is if you see any of those signs, call 911 and note the time that you saw them. Also, we want to know when you last saw them okay. That is extremely important for us. We need to know when they were last seen normal and when their symptoms started. There are medications that we can give if they're within that first 3 to 4 hour window, 4.5 actually, but in that first few hours, there's a medication that we can give for those ischemic strokes that Heather said most of them were. We can clear that clot out or start to dissolve it to increase the blood flow in the brain. That's really critical treatment. All right. But if you're past the 3 hour or 4 hour mark, don't worry. There's still other things that we can do. So some of those treatments we can do up to 24 hours. Maybe not the medication that dissolves the clot, but there are some things we can do. So it's really, really important that we get these patients into the emergency room as soon as possible. Okay. And if it turns out to be vertigo, a little dizziness, maybe a little, ear virus, you know what? That's okay. But it's much better to know it's not a stroke or neurological issue than to wait too long and be too late to treat it. So please recognize these symptoms, use BFAST, practice BFAST. If you see somebody with any of these issues, please feel free to call 911 and have them brought into the emergency room. Now, with that, we have our contact info for every hospital that we have. All right, all of our contact numbers. That's Newton. That's Heather's number right there under Newton. And that's my number there for Hackettstown. You're welcome to call us if you have questions. And I think at this point, we will open it up to any questions that you guys may have been able to enter into your chat. And we really thank you for your time tonight.
Thank you so much, Heather and Lori. That was fantastic. I do also have a post poll. So while those questions are entering into the Q&A, I'm also going to launch the post test in the polls. So you will see some questions appear on the screen. I'll just give that a minute, but you can also begin entering any questions you have into the Q&A.
Well, and while they're answering questions, I think I'll just keep talking. So as we know, high blood pressure is a cardiovascular disease. So it obviously affects for stroke. It also affects the heart. So remember that we now have a cardiac cath lab up at Newton. And that is a great service that goes hand in hand with all of our stroke care and our cardiac care. So we are very excited for that. That's something that this part of New Jersey has not had, and we are very grateful. Heather and I both live, close to these hospitals, and we're in the community. So it's really important that we have those services. We're very excited to share them with you.
Okay, I am going to end the poll. And I do have one question. I've heard several stories in the past few years of younger stroke victims. Is there any known reason why, as to people in their 20s and 30s now being more likely for stroke when they were otherwise healthy?
Heather unmuted. I know she wants to go first.
I think there's a couple of reasons. Birth control use is definitely one of them in the younger population. As we know and Lori spoke about, the communities are becoming more obese and less healthy. So if we have a higher incidence of diabetes, higher incidence of obesity with physical inactivity, that would lead to a higher stroke risk in the younger population.
And we certainly can't argue that COVID has caused inflammation of the vessels and inflammation throughout the bodies. So COVID itself in the community has certainly played a part. We don't have enough data to really have the direct, cause and effect with numbers associated. But I think all of us in the business would agree that we have seen things that we just never would have seen prior to COVID.
Does a cancer diagnosis or cancer treatment increase the risk for stroke?
All right, I'll start on this one. So there are a lot of risks associated with the cancer and the cancer treatments, and a lot of that has to do with sometimes the medications, sometimes the stress that chemo might put on the vessels, but also the coagulopathies, the causes, the increased causes for clotting. So as Heather mentioned with atrial fibrillation, the increased causes for clots being circulated to the heart and the brain, a lot of the cancer side effects will do the same thing. So we're easily dehydrated when we're in treatment. That will increase the risk a little bit as well. And then sometimes the medications and the treatments themselves will increase. Yes.
Thank you for that. Another question that we have is, Although it is genetic to have high lipoprotein levels, what can be done to lower stroke risk aside from lowering the LDL cholesterol?
So again, it would be increasing that physical activity. It would be eating diets low in sodium, so low in salt. It would be eating the healthy fats. So when we talk about saturated versus unsaturated fats, you want the unsaturated. You want to make sure that you're not eating the McDonald's. You want to make sure you're eating salmon, the omega-3s. Avocado is another one. So it's the good fats that will help bring that high cholesterol down. You want to make sure that you're managing your medications. So if you do have any kind of family history or predisposition, just taking your medications and working with your doctor can also help decrease that risk.
Nuts are good for you. So nuts are a healthy fat as well. And, you know, if you do have a history of high cholesterol, not only controlling the LDLs, but being aware of your total cholesterol, your LDLs, and, you know, if you need to go on a statin, then that's certainly an option.
I would also add with diabetes, you want to make sure that you're eating the complex carbohydrates and not simple carbohydrates. So that's eating oatmeal. It's not eating, you know, white sugar or bread. So it's eating carbohydrates that take longer to break down and stabilize the blood sugar.
We just lost our audience, Heather. Everybody hung up on us after that no bread thing.
Another question is, aren't the blood pressure numbers for older folks higher than 120/80 and still considered normal?
Oh, you know, I think I skipped a piece of that slide. So let me just, I don't know, can you still see the slides?
Yes.
Okay, so I think this, the one slide, I didn't go into the numbers particularly, but no, they are for adults. So obviously a teenager, a young 20-something that's very active, you know, the numbers should be a little bit lower probably, but these are meant for adults. So when you look at the normal range, we want to be less than 120/80. An elevated blood pressure could be 120 to 130, okay, and then less than 80, but then high blood pressure starts at 130. The high blood pressure stage 2 that gets more concerning is going to be 140/90. So what we recommend is that if you've got pressure about 140/90, then that's going to be a concern to monitor, and you might need medication for that. If you move past that point and you go up to that 180/120, that's that crisis level, and we don't want that. So the blood pressure categories that we've mentioned, and that I've got on the screen right now, they actually go into normal ranges for the adults, and then areas to watch out for. You know, they'll creep up as we get older for sure, because our vessels are, you know, it's like a rusty old car. You're using the same parts after many, many years. It's going to have some breakdown, a little rust. It's going to have squeaks and, you know, dings that it didn't have in the earlier years. So blood pressure, as we get older, the vessels will show some wear and tear, and they will get a little tougher on their jobs, and a little harder for them to accomplish their tasks. So we expect that, and that's why we have to keep an eye on it. I can tell you in the past year and a half, I've had 2 friends that have had hemorrhagic strokes due to their blood pressure that was not controlled. And as my friends, I had better expectations of them. They should have known. But you know, it's just something that if you're not checking it, it is the silent killer. And honestly, you know, their lives are both changed forever, one very drastically. And, you know, we have a passion about this because it really didn't have to happen that way. And if we can control that blood pressure and avoid those hemorrhagic strokes, well, by golly, we're here to support you. That's what we want to do.
For otherwise healthy adults, how often would you recommend checking blood pressure?
I would say that it would probably be a conversation with you and your provider. Blood pressure really is individualized. So if If you are noticing issues on your yearly visits and it's elevated, then that might be an indication to start checking it more frequently or check in more frequently with your doctor.
And a caution if you're one of those people that wants to go into CVS and check it every day. You know, there's a lot of measuring devices out there, and honestly, a lot of them are great, but if they're not calibrated on a regular, basis or checked to verify their accuracy, don't let 1 or 2 readings throw you into a panic. If you buy something in the drugstore and you use it at home, if you've had it packed away for the last 5 years in a box and that's been, moved around with you and bumped and beaten up, it might not be as accurate as it should be. So there are things, that you need to pay attention to. And just, if you're going to check your own blood pressure, use something that is in working order, that is, relatively new or current, and that you have a way to check it.
I would also encourage checking it in the morning. If you're going to drink a cup of coffee and then check your blood pressure is going to be higher due to that caffeine, the stimulant effect. So all of that can impact it. So that's also why I would encourage that if you are checking it on your own at home and you do find something, just check in with your doctor and discuss, what may have been occurring, so you guys can develop a plan.
Oh, you're still here. I thought she left the door open. I was going to say. Working overtime. Huh?
Hi, Alan. We have Alan eavesdropping on us now. There we go. Do we have any more questions?
There is another one that just came into the chat. This one states, if you already take blood pressure daily and it is sent to your doctor's office every morning and you are on blood pressure meds already and it is often over 130 and over 90, what then?
Well, your doctor is obviously keeping close track of you. So that is the best person to be in communication with on that. And they may feel that your blood pressure at 130 over 90 is a lot better than it is without the medication and without the daily checks. So if they're already on top of that, then that's the best thing. We can't really recommend anything more than that. Your doctor is, your primary doctor is your general contractor for your overall health. And if he feels that you need a cardiologist, hopefully, you've got that partnership and that communication that you can move towards that direction. If it's, a blood pressure issue that has led to strokes or TIAs, then obviously we want you connected with a neurologist. So your physician sounds like he's doing the right job and monitoring you. And the 130 over 90 may not be that detrimental for your specific situation.
Thank you so much. I'll give it one more second on the Q&A if anyone has any other questions. The chat is still open.
We love the questions. Thank you so much for asking them.
Of course.
Heather and I are petrified we're either going to get none or we're going to get too many that we can't answer.
It is always one or the other, isn't it? All right. Well, I'm not seeing any other questions in there. So I'm going to go ahead and close the Q&A. And I wanted to say thank you for joining us tonight. We kindly ask that you take a few minutes after tonight's webinar to complete our program survey. The link to the survey has been added into the chat for your convenience. And I wanted to also say a special thank you to Lori and Heather for dedicating your time and expertise this evening. If anyone has any additional questions or comments, you can send an email to communityhealth@atlantichealth.org or by calling 1-844-472-8499. That concludes tonight's webinar, and thank you everyone for joining. I hope you have a great night.
Thank you, Ashley. Had a great time.
Thank you.
Thank you, everybody, for attending.
Thank you.